This instrument, what I am holding at present, most of the healthcare professions are familiar. And this instrument is known as bag valve mask, or it's often called as Ambu bag, or you can say self-inflation bag or manual resuscitator also. It's one of the crucial tools in emergency medical care for providing positive pressure ventilation to the patient who are unable to breathe adequately on their own. For example, patient in respiratory arrest, inadequate respiration, cardiopulmonary resuscitation. Now, what are the key features and benefits of this bag valve mask? Now, first is versatility. It can be used across various patient population from infant to adult, making it versatile tool in emergency situation. Now, the second is portability. It's lightweight and it makes it suitable for various settings, including ambulances, hospitals, and even in field emergencies. Now, the third is quick response. This instrument allows us rapid insertion of ventilation, which is critical in situation where a patient is completely, breathing is completely compromised. Now, fourth is control ventilation. Healthcare provider can manually control the rate and volume of ventilation delivered with this bag and mask. Now, what are the contraindications with this bag valve mask? First is upper airway obstruction. So if the patient is high, there is foreign body, complete airway obstruction, so it could be contraindication. Second, if a patient is having high risk for aspiration, you have to be careful in those situations. Now, complications that can happen with this instrument could be hyperventilation, hypoventilation, aspiration. That's the big thing that can happen with this, bag valve mask. And the last, if you are doing it against high resistance, like in stiff lung, ARDS, then there is possibility of pneumothorax also. Let's discuss the main components of this bag valve mask. So let's get started.
So let us talk about this very important instrument, that is artificial manual breathing unit or manual resuscitator, or you can simply say bag valve mask. Now, as the name suggests, it has this mask. Okay, so there is this self-inflation bag. It gets inflated by its own, and there is a valve system on both sides of this bag. So this is a unidirectional valve system. This is the patient side. Okay, so this is the self-inflation bag. So this is patient valve and this is the respirable gas inlet. Okay, now if you open this, you can see there is this flap valve. Okay, so you can see this flap valve. This is unidirectional valve and it allows air to go inside, but when you press the self-inflation bag, it will not go outside. Okay, so it will not. This is what is known as the wide bore inlet. This is the small bore inlet. You can attach oxygen there, and you can attach the reservoir system here also. Now, talking about this patient valve system, so you have this connector. So it has a transparent housing. There is this patient end or patient connector, so you can remove, you can see inside. There is also this valve, fish mouth valve. If you press, it can open and allows the unidirectional flow, but it cannot allow air to go inside. So there are expiratory ports also, disc valves also, so that the patient can exhale without any problem. So you can see this is known as inspiratory pressure regulatory valve or pop-up valve or pressure relieving valve. It has spring loaded disc with the tension adjusted so that it opens at desired pressure. So it has a spring, or it has a spring loaded valve, so you can override this valve also. So if you see, have this, in the connector there is this system what is known as civil system. You can move the bag without moving the mask. So whenever patient requires you have to change the position, you can change by this, without disturbing the mask position. So this is known as the swivel system. Now you can see you can override this pop-up valve also. Okay, if you need more desired pressure, you can override this. And in patients where higher pressures are required, like stiff lung ARDS patients. Now let's talk about this instrument. This is Ambu Spur 2. This is lightweight. It has this lightweight reservoir system also. Okay, integrated handle for user comfort, and there is this mask, and you can see this port or side opening. This is known as M port. You can give medication by this port, and you can attach end-tidal CO2. So you can see this is the pop-up valve. Okay, so it's also spring loaded. Now there is this cap. This is known as the splash guard. It prevents the clinician to get this splash of secretion from patient. You can attach PEEP valve also here. So if you need higher pressures, so if you need to give PEEP also, you can attach this PEEP valve. It has this override clip. You can fix it to this pop-up valve, and you can increase, if you want to give higher pressures, you can fix it by this override clip. Okay, so it has this swivel function. You can move the back without moving the mask, and it has this 360-degree swivel system also, so you can rotate it also. So that's it. Thanks for watching this video. If you like this video, please subscribe and give your valuable comments. Thank you.